polio was the worst. That you were really quarantined. Everybody.
Polio back in 1944. My folks and I, my sister, had, everyone was scared of the epidemic. They didn't want to be around the county fairs, everything like that. People were scared to go.
A disease that was almost unheard of in the 19th century soon became one of the deadliest and most feared diseases in the history of the United States. Originally called infantile paralysis, poliomyelitis, or polio for short, was a disease that attacked anyone and everyone. In the early decades of the 20th century and leading into the 1950s, summer epidemics swept through town after town. The results were devastating and the scientific community had little to show for it. In efforts to impede its spread, communities and health boards resorted to century-old quarantine and isolation tactics. These quarantines brought up important questions concerning the balance of personal rights with public safety. The first major polio outbreak in the United States was recorded in the summer of 1894 in the small town of Rutland, Vermont. This is known thanks to the descriptive work of Charles Caverly, who was a local doctor during the time of the outbreaks. Following that, polio occurred in mostly isolated places until the 1907 epidemic that swept New York City. There were over 2,500 deaths, and although this was a lower number than other disease death tolls, polio was the most feared due to its apparent randomness and disabling effects. The climax of polio's recurring summer sweeps was reached in the summer of 1916. There were over 27,000 cases and 8,000 deaths around the country. Death tolls were in quarantine lists climbed to the top of newspapers and even gained their own section in the New York Times. Per capita in New York, the summer of 1916 was the worst polio epidemic to ever occur. Knowing that something needed to be done, public health boards and private institutions stepped up and attempted to curb these outbreaks. Trying to impede these numbers, research facilities, such as the Rockefeller Institute, opened their doors. This institute's first director was Simon Flexner, who worked persistently to determine the causes of polio. Although promising, these efforts produced no cure. With little progress in the scientific community, city governments stepped up to fulfill their responsibility to the people in a time of crisis. Being the epicenter of polio, New York City was often the leader in creating policies and regulations to slow its spread. The man behind these regulations was Haven Emerson, the newly appointed director of the Department of Health, who would lead sanitation and quarantine efforts through the 1920s. The Department of Health's initial task was to identify cases, and if positive, the person would be then placed into immediate quarantine and isolation from all family and friends. Bright yellow quarantine cards that stated things like quarantine, danger, or poliomyelitis would be nailed up on all entrances. If removed, people would face fines that are today's equivalent of thousands of dollars. Although drastic sounding now, these quarantine cards were a common thing and were used to notify people of many other diseases, such as typhoid and scarlet fever. With death tolls still rising, Emerson placed a ban on public celebrations, which quickly spread to the closing of public facilities. With the majority of cases occurring to children under the age of 16, these regulations only applied to children. Newspapers read, "Children under the age of 16 have been barred not only from moving picture shows, but from all the amusements at Coney Island, except those in the open air. 16 playground streets were closed today. The children's rooms in the public libraries and all playground sandlots were closed. Oil will be sprinkled on the surface of all park playgrounds to make them as dustless as possible." Despite these new enforcements and laws, polio cases were still on the rise. By July 25th, almost 3,000 cases had been reported and over 600 had died in New York City alone. At this point, Emerson and the Health Board decided to enact new travel requirements that restricted travel for any child under the age of 16. The inspection of children leaving the city for interstate travel will be compulsory from now on, and all railroad and steamship lines have been notified to that effect. Ticket punchers at station and pier gates will be instructed not to pass any children who have tickets or points in other states unless the children show the federal certificate. With such aggressive tactics being used, there was obvious criticism and backlash. It should be noted, though, that for the majority of people, these policies were perfectly acceptable. There was an unbelievable amount of fear for polio, which was in part dramatized from the media, but most people were willing to do anything to stop its spread and keep their children safe from this horrifying disease. The New York Sun summarized the situation well. Since the beginning of the present epidemic, the Sun has shown that the methods of protection adopted by many communities and dictated by the instinct of self-preservation have led to cruel persecution of neighbor and friend. The latter testifies to the hysteria of the present quarantine. A gentleman passing from one borough of New Jersey to another last Sunday 4 times within 2 hours was stopped, each time to permit the officer to peer into the car for hidden children. Emerson, mostly in defense of his actions, stated, "Health of the individual is a public asset in which the civil government has an interest and for the protection of which broad police powers may be exercised. Such functions were specifically authorized by law, then executed and enforced for the public good at the expense of individual rights." For reasons unknown to scientists, polio cases saw a significant drop in the 1920s and 30s. Counterbalancing the presence of polio epidemics was a new national political coverage that was much in part thanks to Franklin Delano Roosevelt. Roosevelt contracted polio in 1921, and although it went unknown to most of the public, it was an example of the fear that drove quarantines and isolations into existence, the fear that polio could attack anyone, even the president. Roosevelt's administration issued monumental campaigns for polio, the most famous being the March of Dimes. Through this initiative, the White House received more than 2,680,000 dimes that would go towards helping polio patients. This program showed the national support and the responsibility people felt to help those in need.
It was very contagious and it was devastating. And it struck different people differently. Sometimes it would affect the legs, and those people wouldn't then have to be put into an iron lung. It was those that couldn't breathe, and it affected their lungs.
Contracted polio back in 1944. My folks and I, my sister, had, everyone was scared of the epidemic. They didn't want to be around like the county fairs, everything like that. People were scared to go. So I stayed home, and the doctor came. They didn't really know what to treat polio for at the time. And I was quarantined in the house, big yellow sign on the front door. And the doctor actually came every 4 hours, and he gave me a shot of penicillin, which I felt like a pincushion after a while.
Towards the end of the 1940s and the early 1950s, polio cases were back on the rise. In the town of Wytheville, Virginia, cases grew to staggering records. Signs were posted outside of the town informing people not to stop due to the epidemic. The summer of 1950 in Wytheville was dubbed the Summer Without Children. Although it varied in different areas, quarantines and travel restrictions were mostly not enforced or practiced by the government as they once previously were. People began to realize that the quarantines and travel restrictions had not helped. But, as seen in Wytheville, people mostly remained separate out of fear and instinct. From 1944 to 1955, over 361,000 cases of polio were diagnosed. People were more scared than ever and moved their confidence and hope into new scientific breakthroughs. In 1954, successful trials of the Salk polio vaccine caused widespread joy across the country. Although it would take years to fully eradicate polio, people would no longer have to live in fear. The government fulfilled its responsibilities to the people and helped in the distribution of the Salk and Labour-Sabin vaccines. By 1962, only a handful of isolated cases occurred.